Okay, perfect. All right, so today's topic, as you all know, is Beat the Bloat, a naturopathic doctor's approach to soothing digestion and achieving food freedom. I found this little comic on the internet, of course, of all places, by Trini Watkins. And I thought this perfectly kind of summed up what we're going to be talking about today. So the comic is called Regardless. And as you can see, she's eating Cheetos and she suffers. And when she eats salad, she still suffers. So if you can relate to this comic, then this talk is for you. This talk is for anyone who feels like anything they eat will set their tummy off with no rhyme or reason. This talk is for people who have wanted to see someone about their digestive concerns, but have been scared that they're going to be told to cut out gluten and dairy and sugar and all of those great things. And lastly, this talk is for anyone who wishes they could get to a place where their relationship with food was more about what you like to eat and less about what makes you poop like a normal person. We've all been there. So if you can relate to any of those statements or this comic, then stay tuned for the next 40 minutes because this presentation is designed to help you out. So for today's agenda, we're going to go through some of the root causes of bloating and digestive symptoms, as well as my top 4 tips to reduce bloating and get you back on track with your digestion. I've created these slides today to walk through the presentation, but I want you all to know that we don't need to follow my agenda. I'm going to leave time to go over questions at the end, but if you have questions midway through, I'm fine to answer them right away. We don't have to wait till the end. So just unmute yourself and give me a shout. And then to prevent you from needing to scramble and write a bunch of frantic notes, I will be recording this and I'll tell you at the end how you can sign up with your email to get that recording. All right, so before we jump into the juicy stuff, I want to go over a super quick disclaimer. So although I'm a licensed medical professional, nothing I speak about in this presentation should be taken as health advice. This talk is based on a review of current research available and well-known frequently used interventions used by professionals in the field. If you have a pre-existing medical condition, the information shared in this presentation may not be entirely safe or applicable to you, so please consult a healthcare practitioner before making any changes to your health. All right, so with all that over with, now let's get into the juicy stuff, starting with who I am and how I got into naturopathic medicine. So I assume most of you found this talk through the clinic, through Jericho Integrative. I'm the new naturopathic doctor working there. I'm from Ontario. I did my undergrad at University of Toronto in nutrition and then naturopathic college there as well. And I actually got into naturopathic medicine as a patient first when I was a teenager. I was terrified to go to my first appointment, if I'm being totally honest. I was really scared of naturopaths, mostly because I didn't really know who they were and what they did. But I had some chronic health issues that weren't going away. And my mom's friend recommended a naturopath, and I went to see her, and it was great. She didn't make me go vegan or give up any of the foods that I loved, and she got my health back on track. Yeah, so that is kind of my story. And I like naturopathic medicine enough that I made a career out of it. So what exactly is naturopathic medicine? Well, a naturopathic doctor is really similar to your family doctor, and that we're both trained in how to diagnose medical conditions. But where we differ is in how we approach the treatment of those medical conditions. So where medical doctors use pharmaceuticals and surgery, naturopathic doctors use things like lifestyle counseling, nutrition, botanical medicine, and acupuncture. Naturopathic medicine is also focused on treating the root cause of illness. So rather than just give you a pill to make you feel better, can we figure out what's making you feel worse in the first place and remedy that situation? Both systems of medicine are great. And my approach is definitely integrative. I think they each work better when they're done together. So before we get into talking about how to improve your digestion, I think we need to take a minute to talk about how digestion actually works. That way we can kind of pinpoint where things can go wrong. So digestion starts up top in your brain. We have this huge network of hormones and neurological signals that tell our brain, hey, we're hungry, let's start getting things going. So this mental signal from our brain sets us into rest and digest mode. So rest and digest is the opposite of fight or flight mode, which I think a lot of people are more familiar with. So in this rest and digest mode, our parasympathetic nervous system is active. So these signals tell our body to shunt blood from organs like our brain and our muscles into the digestive system. So our digestive system is getting more resources during this rest and digest state. These signals also tell our stomach and our pancreas to start making gastric juices, which we'll talk about when we get to that section of this little flowchart. So the next step after your brain is your mouth. So in the mouth, the steps of digestion are mostly mechanical. So our teeth chew our food, our tongue tastes the food, and our saliva has some enzymes that help to start break down your food a little bit. And then once your food has entered your stomach, this is where the gastric juices and stomach acid kicks in. So stomach acid and enzymes help to break down your food a little bit more. And stomach acid also has a really big role of killing off potentially harmful bacteria in our food. So when you think about, this is not a nice thought to think about, but when you think about food poisoning, it's harmful bacteria that you've ingested. And so our stomach acid plays a huge role in preventing that, which is really cool. So next up after the stomach, our food heads into the small intestines, and food continues to be digested here. This is also where a majority of your nutrients are absorbed. And then lastly, food enters the large intestine, which is this big kind of ropey thing around the outside of the small intestines. And the main digestive role that the large intestine plays is in reabsorbing water from our stool before excreting that stool. And the large intestine also houses your microbiome. So this is the group of about, I think it's 30 trillion microbes that live symbiotically in our guts. And then there's one last piece of this digestive system that I haven't mentioned yet, and that is your digestive muscles. So they run from your throat, your esophagus, all the way down to your anus. And basically what they do is they contract in this kind of stepwise fashion, and that helps to push all of the food that you're eating down through your digestive tube, making it a one-way track instead of a two-way. And that rhythmic contraction is called peristalsis, which I think a lot of people are familiar with that term. So where does bloating fit in this equation, in this story? Bloating is just gas that's trapped in the digestive tract, and it can be caused at pretty much any stage along this pathway. And we're going to talk about what those causes are on the next slide. So now we've talked a little bit about how digestion works. Let's talk about how things can go wrong. So as a naturopathic doctor, identifying the root cause of illness is always a big part of my intake and treatment plan. So before I start prescribing anything, I always want to do a thorough investigation to see where some issues might be coming up. So some of the more obvious causes of poor digestion are ones that happen in your gut. So different medical conditions like irritable bowel disease, irritable bowel disease, colon cancer, or ulcers. But as we saw in the last slide, digestion starts in the brain. So psychiatric conditions like anxiety, depression, and chronic stress can also have a really big impact on our digestion. What we ingest, so substances like food, coffee, liquids, those can also have a big impact on our digestion. Supplements, drugs, those types of things. And then our microbiome health is also really central to your digestive system health. And then lastly on this slide, we have idiopathic causes of poor digestion. Idiopathic is a fancy medical term for unknown. So it basically means we know something's up with your digestion, but we don't know why it's happening. So I think from my experience talking to patients and friends, I think most people can understand how a gastrointestinal disease like colon cancer can cause digestive symptoms. But it can be harder to understand how something in our brain like stress or a bunch of bacteria that live in our gut can cause those symptoms too. So we're going to spend a little bit of time exploring how these things affect our digestion, and then also how we can target them through natural treatment. So first up, we are going to talk about the microbiome. Also, is my pace okay? Give me a thumbs up if we're good. Okay, sweet. Yeah, and like I said, feel free to ask questions at any time. Okay, so the microbiome has many helpful roles for our digestion. One of the biggest ones, especially right now during COVID times, is it acts as a huge immune defense barrier against any bugs that we ingest. So that is a great function. It also produces a lot of vitamins. So most notably vitamin K. We get about 1/3 of our vitamin K just from our gut bacteria. And then the dead bacteria from our microbiome also gets shed, and that helps to bulk our stools, which is pretty cool. But on the flip side, the microbiome is also the culprit at the root of most bloating. So remember a few slides back when I said that bloating is just air trapped in your digestive tract? Well, the air doesn't just end up there. It's made by your microbiome. So our digestive tract can't digest everything that we eat. So the bacteria in our gut end up eating all the scraps that our digestive system doesn't process. And then a byproduct of the microbiome digestion is gas. So the same way that we exhale carbon dioxide, the bacteria in our gut eat our food and then they excrete gases. So where can things go wrong? It's normal for your microbiome to release some gas. Flatulence is a normal part of human life. But what makes, it go from a couple bouts of flatulence a day to painful all-day bloating? So the key word on this slide is imbalance. There are many types of bacteria that are okay in small numbers or in certain areas of the digestive tract. But if they're given the chance to expand and colonize more of your gastrointestinal tract, then they can start to cause problems. So what types of things can cause these imbalances in our microbiome? The first one on the list here is antibiotic overuse. And I am by no means against antibiotics. I think they're amazing and fantastic and have helped us survive for many, many years. But overuse or chronic antibiotic use can lead to some imbalances in our microbiome. And that is mostly because antibiotics are non-specific. So for example, if you're taking antibiotics for an ear infection, the antibiotics aren't just going to kill the bacteria in your ear, it'll also kill the bacteria in your gut. And for the most part, our guts are pretty resilient, and most people are able to return to normal microbiome balance after a round of antibiotics. But if someone is on them chronically or for a long time, then this can lead to issues. But the great thing is that this is pretty easily treatable with probiotics. Your family doctor or a naturopathic doctor or a dietitian can help prescribe the right dose for you if this is something that you're struggling with. And another thing that can cause an imbalance in your microbiome is consuming high levels of artificial sweeteners and FODMAPs. FODMAPs is kind of a new buzzword, I think, that a lot of people are seeing online. So it stands for fermentable oligodense monosaccharides and polyols. These are basically just fermentable starches that are in foods. So as with anything in medicine and nutrition, not everyone is going to have a reaction to these things. So some people can have, 6 Diet Cokes a day and they're going to be fine. Other people will have, a couple drops of stevia and their gut will be all over the place. And that's because just like we have different genetic codes, we all have different microbiome makeups. So some people have a high number of bacteria that feed off of these poorly digested food constituents. And other people have low levels. So that's kind of one of those personalized things in medicine and in nutrition that if you can figure out if that's something that applies to you, you can really help yourself to improve your digestion there. Yeah, so basically what happens is that artificial sweeteners and high FODMAP foods, these are components in food that are difficult for our bodies to digest. So for artificial sweeteners, that's done on purpose by food manufacturers. They want it to be something that we can't digest so that it's 0 calorie. If you can't digest it, you can't get any of the calories from it, right? But that means that it makes it into your digestive tract and it can become food for your microbiome. And then consequently, your microbiome can produce gas from eating those artificial sweeteners. And then lastly, stress is a really common culprit of microbiome imbalance. And we will have a whole section on stress in just a few slides. So I'll expand on that in a couple of minutes. Okay, so that discussion brings me to my first tip, which is to eat a varied diet that includes lots of fruits, vegetables, and probiotic foods, and to limit artificial sweeteners. So we've already talked about why we want to limit artificial sweeteners, as they are known to aggravate those IBS-like symptoms and bloating. And again, like I said, that doesn't apply to everyone, but if you are someone who struggles with bloating and digestion, it can be a good call to try an elimination of artificial sweeteners. So check food packaging labels, especially for any diet foods, and just make sure they don't have artificial sweeteners, including things like stevia. And then in terms of general diet, microbiome research is relatively new in the science field, and while a lot of discoveries have been made, there's still a lot that's unknown. But one thing that shows up very consistently in the research is that a varied diet, one that includes a wide variety of food groups and foods within those food groups, tends to support the microbiome the best. So if you're struggling with getting to that point, where you can eat a varied amount of foods, individual help from a dietitian or naturopath could be helpful in getting you on the right path. Okay, and then the next root cause that I wanted to dig deeper into is stress. And I have another comic from the same author that I think sums this up really well. So this one is saying, I have IBS. And then she's asking, well, what does that mean? Says it means I poop my feelings, which if anyone here has IBS, I think you can probably relate to that. So how does mental stress end up having physical effects on our body, like bloating or diarrhea? Well, your mind and your body are connected through hormones. We've already talked about these hormones and how they can put us into that rest and digest mode. But we also have a separate hormonal system, your sympathetic system, that puts your body into fight or flight mode. So what happens is when you experience a stressful event, it activates those stress pathways, that fight or flight, that sympathetic system in your brain, and that leads to the release of stress hormones from your brain and various other organs. And then those stress hormones have other effects in the body. So when we were talking about the rest and digest system, we were talking about how that system shunts blood to your digestive tract. Well, your fight or flight system does the opposite. It shunts blood away from digestive organs and into the parts of our body that are more important for survival. So things like our eyes, our muscles, and our brain. And evolutionarily, these pathways were designed to help us survive as hunter-gatherers. So the stressors we were experiencing back then were things like bear chases. So that adaptation makes sense. You want all your resources going to your muscles and not your stomach, because you're trying to outrun this bear. But now our stressors are things like traffic and emails, and we definitely don't need our muscles to get out of a tricky email situation. But that's the pathway that our bodies have evolved to have. So when we experience chronic or long-term stress, our bodies can have a hard time getting into that rest and digest mode. So this can mean that our stomachs might not be producing very much stomach acid because they're not getting those signals from the brain. Same goes for our pancreas. It might not be producing as much gastric juice as it should. And then also our digestive tract muscles, that peristalsis, that moves slower because it's not getting those signals from your brain either. So what does this mean for bloating? Well, often this means that food that should be getting digested and absorbed in the upper digestive tract ends up not being digested because the body isn't working as efficiently as it should. So undigested food ends up in your large intestine, which, if you remember back earlier in the presentation, that's where most of our microbiome is. So all of this undigested food is making it to this big bank of bacteria, and they go crazy feeding on it and go crazy producing gas. So all of these changes in our digestion can cause acute problems, but over time, chronic stress can also actually change the makeup of your microbiome. And they've shown this in quite a few studies, which is really interesting, but also kind of scary to think about.
Yeah.
I'm just going to mute. Okay. So that brings me to my second tip. And in my opinion, this is probably the most important tip in this presentation. And that is that stress reduction, especially before meals, can help to optimize your digestion. So how do we reduce stress in general and before meals? General tips for reducing stress are things like meditation. But if you're really looking to target reducing stress before a meal, this means consciously taking ourselves out of fight or flight mode before we eat and putting ourselves into that rest and digest mode. Easier said than done though, right? So my top tips to actually help yourself do this is 1, take a break when you're eating. So find a seat, put away your work, your homework, your emails, and just focus on eating. Another great tip is to avoid screens. So even if you think that scrolling social media is relaxing, I can guarantee, depressing news headlines or that annoying friend from high school are all setting off more stress signals in your body than you think. Not to mention mindlessly scrolling or watching TV takes our focus away from our food, which can cause that disconnect between your brain's eating signals and your digestive tract. So if you're the type of person who absolutely must watch something at mealtime, because I know there are lots of us out there, I'm the same way, try to watch something relaxing and food focused while you're eating. So something along the lines of Great Canadian Baking Show or British Bake Off, rather than like a Gordon Ramsay type show, because that would probably be more stressful. And then my next tip is to take 10 deep, slow breaths before every meal. Taking those deep breaths can actually activate our parasympathetic nervous system, which basically taking the slow deep breaths mimics our breath when we're sleeping, which is usually when we're in parasympathetic nervous system or rest and digest state. So, it only takes 30 seconds, sit down before a meal, take 5 to 10 deep breaths, and then get into your food. And then lastly, connecting with your senses and eating mindfully is a really great way to reduce stress before meals and put your body into that rest and digest mode. So I usually tell people to try and connect to your food with all of your senses. So look at what you're eating, smell the food, focus on the taste of your food, the texture, and slow down. Don't race through your meals. Try to enjoy them as much as you can. My next tip is also related to stress. But this is more general stress and less like right before a meal. And that is just to exercise regularly. I feel like this is the most stereotypical naturopathic recommendation, but it is because exercise really is that good for you. Among the many benefits of exercise, it has been shown in many studies to help reduce stress levels and cortisol levels, cortisol being one of your main stress hormones. So if you aren't active already, I know for a lot of us, myself included, COVID has been a time where our activity levels have dropped. So if you're not super active right now, start with something gentle like walking, stretching, or yoga, and then aim to work up to 30 to 60 minutes of exercise 5 days a week. And my biggest tip for exercise is find something that you genuinely enjoy doing. So for me, that's dance or hiking or basketball. If it's something that you really like, you're more likely to do it consistently. And then it also has the added bonus of stress relief in that you're doing something that makes you happy and that brings you joy. Yeah, so that is my third tip. Okay, now that we've talked about our microbiome and stress, we're going to talk about substances and how they can affect digestion. So substances is a pretty big category, but in this context, I'm not talking about food. I'm talking about the other things that we consume. So things like caffeine, alcohol, supplements, nicotine, medication. A lot of these substances can affect your digestion. So some through direct action in your digestive tract, and others actually work through the nervous system. I think a lot of us are aware of how these things affect us. For example, you definitely know if you're sensitive to caffeine. I'm one of those people. But there's a lot of hidden things that we might not be aware of that might be affecting our digestion. So one important one to note is hidden laxatives. A lot of weight loss products, skinny teas, those types of supplements will contain laxatives that have obvious effects on your digestive system, but a lot of times we might not know that they're in there. So just a reminder to check all the ingredients on your supplements or your skinny teas and make sure that there isn't anything in there that could be causing your symptoms. And there's one more substance that I want to talk about that I think is often overlooked, and that is water. Now you might be thinking, I've heard this spiel a million times. I know I need to drink 8 glasses a day. That's not the spiel I'm here to tell you. What I actually want to talk about is that sometimes drinking too much water can actually cause bloating. I have a lot of patients who forget to drink water during the day, and then, before a meal, they chug their whole water bottle because they want to get in their 8 glasses. Well, chugging a whole bottle of water or a whole glass of water right before a meal can actually dilute your stomach acid and digestive juices, making it harder for your body to digest the meal that you're about to have. So in a lot of people, that's totally fine. Your body can compensate and just make more stomach acid. But for a lot of patients, especially elderly people, because your stomach acid production decreases as you age, or patients who are chronically stressed and are already not making enough stomach acid. In those cases, then the additional water right before a meal can dilute stomach acid to the point where you're really not properly digesting your food. Undigested food then in those situations can end up making it further down the digestive tract. And like we talked about before, this exposes it to more bacteria that can potentially produce more gas. So this brings me to my last tip, which is to try and drink most of your water between meals and to incorporate herbs into your meals. So while drinking too much water before a meal can dilute stomach acid, there's so many herbs that actually stimulate stomach acid and other gastric juice production. So many of our culinary herbs, the standard ones you have in your kitchen, actually encourage this stomach acid production. So things like ginger, thyme, sage, rosemary, turmeric, fennel, chamomile, and mint, they all promote digestion and are great to incorporate into meals. So now that we've gone over some common causes of bloating and some things that you can do at home for it, I also want to take a minute to talk about those situations where you've tried everything and you just need that little bit of extra support. I've definitely been there before, and it can be a really isolating feeling. So I want you all to know that you don't have to do it alone. I'm obviously partial to naturopathic doctors and naturopathic medicine, and I think that we are a great resource, but there are many other great healthcare practitioners that can help. Family doctors are really amazing if you're lucky enough to have one in Vancouver, and they can do a wide range of testing as well to rule out other more serious conditions. If chronic stress is something that you are suffering from, or anxiety, and you think that might be related to your digestive symptoms, then a counselor or a psychologist is also a great resource. And dietitians are really amazing as well. And they also, most naturopathic doctors are covered under extended healthcare insurance, but I'm pretty sure in BC, you can get a dietitian covered through your family doctor. So that's also a really great option. So if you've never seen a naturopath before and you're not sure how a naturopathic doctor would approach a digestive case, I just wanted to kind of walk you through a little bit of what to expect. So as a naturopathic doctor, the first thing we do is a really thorough intake and diagnosis. And as we discussed earlier in this presentation, that's because root cause is a big part of naturopathic medicine. So we want to see, are there things that are contributing to these digestive concerns that we can address and treat before just, putting a Band-Aid on it. Yeah, and so that is the first part of treatment with a naturopath. And then we also like to support the pillars of health. Everyone wishes that there was a quick fix, especially for digestive concerns, but there are just some lifestyle changes that really need to be made for long-term success. And those can be really hard to make on your own. So naturopathic doctors are great because we're trained not just to know what lifestyle interventions are effective, but we're also trained to know how to help someone make those changes. Yeah, and lifestyle changes can take time. So while we're working on those, I also like to provide targeted support with supplements and or acupuncture to help provide some more immediate relief. So these can be herbal supplements, nutritional supplements, or as I said, acupuncture is also great. Yeah, and then lastly, collaboration with other healthcare professionals is something that I love. The healthcare professionals I mentioned on the previous slide are my go-tos for digestive concerns usually. So as promised, I have recorded this presentation. So if you want to go over it, send it to family or friends. That will be available for you. To get the recording, you can either send me a little private message in the chat box here on Zoom, or if you go to my website here on the contact page, there's a little section at the bottom where you can send me your name, your email, and then just write me a note that says that you want the recording for this talk. And I also have a couple handouts with just some extra tips on digestion and stress. And lastly, as a thank you to everyone who attended tonight, I'm offering 20% off of your first visit with me at Jericho. So if you call to book in by next Thursday, so the appointment doesn't have to be within the week, but you just have to call in or book in online within the week, and just leave me a note that you attended the talk, and then I'll take 20% off of your first visit. Yeah, if you've been struggling for a while with digestion and you're at the point where general tips aren't really helping anymore, a one-on-one treatment approach might be what you need. And naturopathic visits have the benefit of a lot of time. My initial visits are a full 75 minutes. So we have plenty of time to talk about lifestyle, your health history, and also discuss the treatment plan in depth. Yeah, so that we can make sure that it's a treatment plan that is sustainable for you and something that you can realistically implement.